MASIKA.
Yes.
It's a pleasure to have you this Friday. How are you today?
I'm fine.
How have you been? How has your week been?
A bit tedious, but I'm okay.
Okay.
Yes.
So, for the benefit of our audience, we'll just start with an introduction of yourself, and you'll tell us a bit about yourself, and then you hold the role of the medical superintendent at VTRH.
Yes.
So you tell us, what does this role involve, and VTRH is a big hospital. So what are some of the responsibilities you get to do, and what's the relevance of now the hospital that you're the MedSup at in the county's health system?
So my full names are Dr. MASIKA. I'm a 43 years old male. I'm a health system specialist, having graduated from the University of Nairobi as a medical doctor and also with a master's in health systems management. I've been serving then moved to Vihiga County. Then it was called Vihiga District Hospital as a medical officer, which I served for around 1 year or so. Then I was posted to a higher sub-county hospital to start the higher sub-county hospital, which I served as a medical superintendent for 1.5 years. From there, I proceeded to do my master's in the University of Nairobi, which I completed in 2017, and came back, served as a deputy medsup in Vihiga County Referral Hospital then. It was VTRH then. Then from there, I was moved to that was around end of 2018, I was moved to serve as the medical officer of health for Sabatia sub-county, which I served for some time, maybe 4 months or so. Then I was appointed a director of medical services for Vihiga County, which I served for 1 year. Then from there, I moved to hospital working until sometimes in 2023, when I was reappointed in the sub-county MOH for Vihiga sub-county, which I've served until August this year, when I was appointed by the County Public Service Board to serve as the medical superintendent for Vihiga County Referral Hospital. Vihiga County Referral Hospital is situated in Lugaga wa Muduma Ward. It is a level 4B facility, although we envisage to upgrade, plans are in place to upgrade it to a level 5 facility. It serves the whole community in Vihiga County and even their neighboring counties. It has a 160-bed capacity with a number of services to our clients. I can say that we are doing optimal as per now. All the departments are working. Our hospital they have the radiology department, which encompasses the x-rays and the CT scans and the ultrasounds. Then we have the inpatient wards, that is we start with the pediatrics, the female ward, our maternity, and our male ward. Then we are also privileged to have an amenity arm. We are SHA accredited, and we have also EON Minet as one of, and we also accept other insurance for our clients. So far we welcome all our residents to our facility, and we are prompt at offering services. We have 3 running ambulances now fully fueled, and we can get referrals or send our referrals to any place. We majorly send for very specialized services. We send our referrals to MTRH, who really assist us.
Yes, thank you for that. And some of you've helped us understand your background, and thank you for that. So that if anyone would like to be a medsup, maybe they'd like to know, they can see through your journey what they can study and also what it takes to hold a role such as yours. And congratulations again for your position as a medsup. You mentioned you started in August.
Thank you.
So we're grateful to have you in this episode. And some of the things that I'm sure as a hospital you manage are breast cancer cases. And this month is Breast Cancer Awareness Month in October. So what is the hospital, what has it been doing about this? Are there any advocacy efforts, or if people would like to get more information of this?
So as a hospital, we've been involved in the breast cancer awareness that's this month, and we have done it in 2 or 3 prompt way. One, we have been involved in the sensitization activities. Some of our staffs have been involved in outreaches and whatever, giving the information to the public. 2, our screening through our surgical clinics has been ongoing, and so identify the screening is both talking to the patients, identifying if the conditions are there or even there are any danger signs, the patients are advised. And we, through our surgical clinics, if need be, our patients are screened in our labs, which we do a myriad of tests, ultrasound, mammography, and the rest. But for those, and even FNS, but for tests that are needed that are more complicated, of course, we have online pathologists that help us when the tissue are taken from pathology, cleaned up with several numbers. And we have been so far been able to identify those ones who need services. And if it is surgical, it's corrected here. If it is chemo, we have our oncology wing, a satellite, which handles the cases. And so far, we've been actively involved in the process. Thank you.
Thank you for that. And you mentioned surgical camps, and yes, one of the things I know that the hospital is having a free surgical camp with Operation International next week. So what more can you tell us about the surgical camp happening next week? What are some of the surgeries that will be conducted, and where do citizens need to go to? How do they register for this?
Yes, thank you for that question. As we are talking from this Sunday, our operational international volunteer doctors are jetting in, being headed by Dr. Ian, who is already in the country as we are talking. We've all, just even before this interview, I was chairing a meeting which we were doing our final preparations, and everything is geared towards that. A month or so before this, we've been doing the screening and recruiting, and so far we have over 200 clients for the operation. But of course, the history has been, a month ago we did the same activity, and history has been that most people present once they notice that something has happened, they go talk to the people. So we expect a multitude of people. Now we have 4 or so visiting surgeons. They will majorly deal with head and neck. They will be jetting into the country by latest Saturday evening. We've made plans for accommodation and everything for them. We're having our team of surgeons locally who are 3 on site, and we have 5 doctors also on board, but with a number of specialties around that. And we are fully prepared because we've already procured the drugs, the non-farms, and everything needed for the camp. So we welcome all our populace. We shall majorly deal with head and neck, but our general surgeons will also attend to other complications that are needed for the operation. But what we are urging our people is that to enroll on SHA, because once you enroll on SHA, it will also help us access services and make it easy for us, for the people who are coming. So karibuni sana for the camp, and we aim to access many people so that we help our population. Thank you.
And so the camp will be housed at the Vihiga?
Yes, the camp will be hosted in our Vihiga County Referral Hospital. We shall have 5 operating theaters, yes, to handle the program. It starts on 26th and it ends on 30th of this month.
Okay.
Yes.
And you've mentioned a couple of clinics, and one of the clinics you mentioned was talking about cancer is the oncology clinic.
Yes.
The referral hospital has other clinics, and
yes,
one of them being the eye clinic.
Yes.
Can you tell us about other clinics that are present in the hospital, and including those that are under construction? Because I know there's a maternal center that's supposed to be completed.
Yes. So I would start with the existing clinics. We have a medical outpatient clinic, we have a surgical outpatient clinic, we have an ENT clinic, we have the eye, which is a full department offering operation services, and it has been being majorly supported by our county government and a program called VIP, which is winding up this month. We've been offering a myriad of services. We have an ophthalmologist and a team of experienced nurses in that department, and anyone with eye complications, I think, should come. We have an oncology satellite that is handling a myriad of cases, and it's fully operational. Yes. I think in brief, those are the clinics that we have. We have a psychiatry unit, fully functional. Then we have an hemato-oncology unit, fully functional.
Okay. And one of the residents raised that an issue that they were not able to get services at the oncology clinic. Do we have an oncologist on site? Is it fully operational, or how can they now seek
We were having an oncologist on site, but unfortunately, we have an oncologist present as we are talking, and we have trained oncology nurses and clinicians. So the clinic is the unit is a full unit, it's not a clinic. The full unit with a hood and everything is fully functional. We can administer all the drugs, but we consult closely with MTRH for a number of things over the same.
And now speaking of concerns being raised, so there have also been concerns raised about the quality of care received at our hospitals, especially at the referral hospital. So are there any plans in place to improve this? And does the hospital have a grievance system? Like, where can people make complaints, and have there been any improvements that have been done since because we see these complaints on social media. How does the hospital handle them, and where can, apart from just raising them online, do we have an office or a system in place where we can come and raise these issues?
Okay, I would like to report that an office has a grievance mechanism which is called physical and online. We have our Facebook account, TikTok, and all WhatsApp online platforms managed by one of our media guys called Mr. MASIKA, who has been running them. So you can log in with Bigger Teaching Referral Facebook account. You can get your comments there, and we also share what we have done there. Also, our hospital phone is on. Even my number is shared. So any grievances that are directly needed by us as the medicine, they get to my desk. This is a public hospital. We are serving. This is a public hospital, and we are serving clients. And we really envisage that we improve from feedback from the clients, because the bosses for us are patients, clients, not us. So we take criticism positively. We learn from it and we work from it. A number of the concerns are genuine, because we have a number of staffs. You might not know, if you are managing over 200 staff, people are immediate, but we correct once we get the whatever complaints are. The most complaints that were present was one, it was the CT scan, which is now up and running. We're also having some drug shortages, but we would like to thank His Excellency, our Governor. We are funded, and we have been able to procure drugs in non-farms. And I was talking to the pharmacist, we have a 70% refill rate. To me, as a public hospital and as a health expert, I think we are doing near optimal. Also, our lab, I myself have organized for blood campaigns, and even in the morning today, we had an accident around the Igunga area, and the populace can attest that they were promptly served by the hospital. All the things needed were present as far as I'm concerned.
Thank you for that. We'll go on a short break and encourage our audience to ask your questions to Dr. MASIKA in this episode with the VTRH medicine. are commenting and saying excellent, very good explanation.
Hizi nini bado ndio kata kulicho.
Hapo nikiguza haitani. Haitafuta.
Speaking about the different clinics that we have at the hospital, we also talked about Breast Cancer Awareness Month, and we encourage all our residents, please visit the And so, Dr. Masika, you had mentioned drug shortages, and one of the things we usually see people asking is that you go to hospital, you find that was militia. So how does the hospital handle drug shortages and when they arise? What does that look like from your end?
Okay, what I would like to report is that you cannot have a running hospital that if it doesn't have things called drugs and non-pharmaceuticals. Those are the most essential things. So as under my management, we have prioritized on the budget, and we would like to thank the government of county government of Vihiga for availing resources. We have really tried and made sure that we have a seamless supply. Just 2 weeks ago, we had drugs supply from KEMSA, what's around 12 million shillings, which is really helping us. We also had a refill to meds with a refill of around 4 million shillings. So I cannot say that we have all the drugs. No, I would be lying. But we have the essential drugs needed to run after our survey of what the common conditions around that we can manage. For those few that we don't have, actually, ideally we should have one, but there's no also that is fully stocked. Now, what I discussed with, we have a HPT committee in the hospital that looks at these commodities. and it's chaired by the pharmacist, Dr. Martini. And I've always been at his neck. They meet frequently and assess stocks so that we don't wait until stocks are out when we buy. So we are doing regular refills through meds and even cancer. Yes.
And so you also spoke about the CT scan and another machine that have been non-operational and sometimes they're not working is the dialysis machines.
Yes.
Are they working now or what's the
We have okay. Normally we have been having 8 or so dialysis machines working. Unfortunately, these machines were being brought by the MES program, and there's a time it wound out and they were not being repaired. So some went down. So we have only one working dialysis machine. We are on a program to get replacement. We have so far identified some companies which I'm going to not name here, but in the next 3 weeks or so, I think we should have some 7 dialysis machines on placement to handle our residents. On that department, I'm a bit sorry to our clients. It's good to say the truth, but we are really working around the clock to make sure that the department is fully running.
So, but once the dialysis machines are up and running, we'll be able to use
Yes.
residents.
Yes, the one is working.
Okay.
It's handling. We have a one running, fully running, but the other 7 are needed to handle the larger. MCTs and the chronic kidney disease is now very common. So we have a number of clients. So we have need all the 8 machines to work optimally.
And so, apart from the issues that I particular system in place to check that is this machine working, how is this this department, is it working well before it reaches the citizens, and are there any initiatives in place to now curb this so that by the time the dialysis machine is not working, you're well aware of it and you're able to sort that out or inform people?
Yes, I would like to report that. See, when I came to office, that was in August, we've got 3 firms that have audited all our machines. And as we are talking, we have the status of all our machines, when they were last serviced, when they are due for service, and everything. And as we are talking, even there's a group of engineers on site maintaining most of our machines. I think with that operandi, I think we'll not have failing machines. But you see, also machines have a lifespan. So if a lifespan plan that certain machines has an 8-year lifespan, another one has 10. So when they near completion, we should always see a way of seeing how we procure or release so that we continue services. Thank you.
And to partners, because we've also seen that a lot of these services are supported by our partners.
Yes.
And a few weeks ago, we had the Foundation and the
Yes.
Gertrude Hospital Foundation were here to start the Doctor Smart program, which will be housed at the referral hospital.
Yes.
And one of the things they are to set up is a telemedicine center.
Yes.
So how will this improve services and benefit residents?
Thank you, Shamim, for reminding me that. Actually, I would like to first of all thank M-Pesa Foundation. M-Pesa Foundation have completed for us a mother-in-charge hospital, a fully maternity equipped and everything. Whatever else we shall just do is getting HR, and that should start in. The hospital is already complete. The equipping is more than 90% being done. So it's just us to get HR and moving. So I would like to tell Viga residents that maybe from November on, the mothers and children will not come into the old hostel. They will be going down there to the new hostel that is complete. Now, apart from that, M-Pesa Foundation, in conjunction with Gertrude, they are setting up a telemedicine center, and this will be purely for pediatrics. What telemedicine center will entail is that kids that are being seen by our specialists and they need to be consulted by the specialists in child care will be being brought to the telemedicine center, and the Gertrude specialist will be consulting and giving us solutions to our clients from there. And I can like to tell our residents that in the current world, in the modern world, we need a virtual hospital. And I think Vihiga is en route through the help of M-Pesa Foundation and in cooperation of the county government of Vihiga that we are moving towards the same that direction. And without even forgetting, we would like to thank also the excellent governor for bringing up our plaza, 5-floor plaza that is near completion. We just appeal that once it is equipped, I think we shall open the scope of services to our clients. Thank you.
And you've mentioned now the referral hospital has a lot of units, a lot of clinics.
Yes.
So how does the hospital manage a high traffic of, maternity is always busy, the children are always coming in to get tested. How do you manage this busy centers, especially maternity and the outpatient services?
I would like to report that the hospital, Vihiga County Referral Hospital, has a management organ called the HMT. This is composed of HODs, but let me go specifically to that one unit. Maternity has a HOD managing the wing, and has a group of, we have 2 gynecologists, we have 4 doctors, and we have a number of nurses. I think, okay, I'm not specific about the number, both on locum and employed, and support staff, and so specifically for that department. They work in coordination. So the HOD, through the nursing officer in charge, to the office of the medicine, and now even the office of the CEO, as I'm talking, we have even forced to put beds in the corridor, but this one will be solved now by the new units that has been brought up. But I can't tell you that our clients really are accessing our services in such a department. And this is done seamlessly through the coordination between the HOD and the management.
Okay.
Yes.
So all residents who come into hospital are able to
Yes.
get services?
Yes. Yes, and the people like coming for maternity, they don't queue in outpatient or in OPD.
Okay.
They come straight to the department.
To
Because
maternity.
even we have a share desk, we have a reception, and everything is done. Even bidding and everything is done in the department.
Okay, and how do you manage now outpatient services? Because that's usually also
Yes,
high traffic.
our outpatient, we have 2 doctors who are on the locum in outpatient, and we have a number of clinical officers. I think they should be numbering to around 20 or 30, 25 to 30, who are domiciled in outpatient. Now, there's a difference between outpatient and emergency and A&E. And even E&E also has a number of doctors. I think there should be around 5 to 6 domiciled in A&E. Then there are no clinicians in A&E, but there are doctors and nurses, and the consultants are on call there. Like even in the morning today, we had an emergency, and before even this there, it was promptly handled. We didn't have any referrals, although the ambulances were fully fueled and waiting to ferry away clients who might need more specialized services that we might not be offering.
Okay.
Thank you.
And as we conclude, we'd also like to tell our residents that because we often just go to a place and we see one thing is not working.
Yes.
And we complain. So what reassurance can you give residents that services are improving at the hospital? And I know there are new officers who come on board to support
Yes.
the management of the teaching and referral hospital. So what reassurance can you give us? What more can you tell us on the new officers?
Okay, I would like to report that currently I'm the MEDSUP and also the Deputy CEO for the institution. We have been privileged yesterday or the other day to be posted a CEO of the institution is called Mr. Titus Mumia, whom we are working seamlessly to make sure that the institution is running. But what I can say is that I encourage our populace to give feedback, because we take that feedback positively, so that's what informs our decision making, because they are the clients, they are the users of the service. But so far, I have attended a number of functions. I happen to have lived here for some time, but I have attended a number of funerals and group, and I think generally our populace are somehow happy with our services, because if you can come in 10-20 minutes, you have got the service. The only problem is we have system outages by SHA, but SHA is working. That's when well coordinated, and I encourage our people to register with SHA to access services without having this out-of-pocket payment, which is very erratic.
Okay.
Thank you.
Thank you for that. And just also as the final, questions. What could you explain to us now the process of accessing? Where can people? Because everyone knows where VTRH is in Bali. But how does one go about? Because I know you have to register, and you've mentioned that maternity you can just go straight to maternity. So for those who, you need those services, please do not queue at the entrance.
Yes.
And are there any officers in place who guide these residents when they come in, so that they're able to go to the right place and also reduce this congestion? That
We have a reception desk just near the gate. There's a waiting bay, there's a reception desk here, but we have 2 or 3 more reception desks in just the front outpatient, OPD, before OPD. Then on the left side when you enter, there's the SHA. It's a whole room. There's the SHA. It's not a desk, it's a whole office with like 5 or so clerks and everything. Then we have domiciled a number of, they're called CHUs, there are 3 or so there. Then after that, when you're going to that pharmacy again, there are 3 or 4 desks. These ones are just to take the preliminary tests, the BPs and everything before you are handled and go to that. Then the first payment point, there are 2. They are at the outpatient. Then there are some as we move to the ward. So I can tell our clients that we are moving towards improving services, and as we are talking, we are reviewing our strategic plan. We are reviewing the implementation matrix and doing a number of policies, just to mention a few, that will help us improve services. We are also in the process of accessing more donors. With the limited resources, the scope also is limited. So we are approaching more donors so that we can improve our services.
Okay.
Thank you.
Thank you. And as a final question, what message would you like to share with residents of Vihiga regarding the hospital's commitment to quality care, and also just to invite them to the
First of all, I would like to say that we love our people of Vihiga. Vihiga has very good people. Unless we have really messed, we see them seamlessly and quite accessing services. Now, we are also appealing to the political wing that, okay, anyway, we have improved the infrastructure and everything, but we still request that we need more equipment, more drugs and everything. Then also on staff motivation, yes, we thank the government. We have had people going for trainings, going for further studies, but still we request that more motivation to our staff will be good, because without an empowered staff, we will not go far. And I would also like to report to our management that we are now working as a close team, and even this year there are a number of things we are planning, including an end-year party that will even be open to the public, so that we come and we showcase what we are doing, and we get also compliments or reviews from them. Thank you.
Thank you, Dr. MASIKA. We thank you for joining us today, and again, we encourage our residents to come to VTRH next week. We'll have the medical camp forehead and neck surgeries, and we look forward to Hospital Plaza's completion. So, and all the other centers that have been mentioned during this episode that are under construction. Continue engaging us on our social media channels, and as Dr. has said, please feel free to walk to VTRH and give your feedback. And we thank you again for your questions and helping us also improve healthcare and improve services, especially in the health sector. Thanks again, and see you next week on Feedback Friday.